1.4 billion jabs and counting. On June 20th, China became the first country to administer 1 billion doses of COVID-19 vaccines. In terms of absolute numbers, India is a distant second with close to 400 million jabs, followed by the US. So how did China do it? How far is the herd immunity? And what exactly is the government's plan to achieve that goal? We'll try and decode that in today's video. In March, the Chinese government set out two big vaccination goals. First, fully vaccinating 40% of the population by June, and two, 70% coverage by the end of 2021. According to the latest numbers, the first target was achieved days before the deadline.
Health authorities said more than 630 million Chinese have been vaccinated. That accounts for more than 40% of the population.
And the gap between the jabs and the jab-nots has been shrinking. On June 24, China broke its own record and injected 24.7 million doses in a single day. At this rate, the nation would have fully vaccinated the entire UK population in 6 days and Australia in just 3. Daily vaccinations have increased over 2 million doses a day in late March to an average of more than 18 million in June. India, which has a similar population size, did around 4 million in the same period. So when many countries are struggling to find vaccines or the willing arms, how did China reach the 40% threshold? Free eggs and shopping coupons may have attracted a few, but there are bigger forces at play here. Number one, the availability of vaccines. China has ramped up domestic production of its major vaccines at a blistering pace. The country is expected to produce more than 3 billion vaccine doses this year, and according to some estimates, it could reach 5 billion by 2022.
Currently, vaccine manufacturers are racing against time on this, making it China's highest and fastest increase in production.
Number two, a streamlined approach with clear messaging. In the US, for example, like mask wearing, vaccination too has become a divisive issue. Anti-vaxxers and conspiracy theorists are having a field day.
So I have a key and a bobby pin here. Explain to me why the key sticks to me. It sticks to my neck too. I got this.
Yes, it actually happened. But in China, science took the front seat with massive mobilization of resources. Makeshift vaccination centers are set up, mobile vaccination buses have been introduced, employers and neighborhood associations roped in to reach as many people as possible. According to a survey, China is also among the few countries with a lower rate of vaccine hesitancy. Sporadic outbreaks have also helped the vaccination campaign. People who were early undecided are now choosing to come forward. Guangzhou saw massive queues for vaccines days after an outbreak was reported in the city. But the challenge is far from over. The evolving variants have complicated the situation. As we mentioned before, China's next target is to inoculate 70% of its population by year-end, while some experts believe over 80% coverage is needed to reach herd immunity. And then there are uncertainties regarding the efficacy of vaccines against the dangerous Delta variant, the one that wreaked havoc in India and is spreading fast across the world. China's leading infectious diseases expert Zhong Nanshan says that local vaccines are effective in preventing infections and hospitalizations.
And we can see the vaccine provides protection. The result shows 60% effectiveness in preventing infection and 80% effectiveness in preventing severe cases.
The government also faces an uphill task of increasing the vaccination rate across provinces, cities, towns, and villages. For example, by the first week of June, Beijing had fully inoculated more than 70% of the total adults, while in Guangdong province, it was less than 20%. Since then, the vaccination rate has dramatically picked up. But given its size and population, China has a long way to go. But there are some big takeaways for the rest of the world. China has a zero-tolerance approach even towards a single case of COVID-19. Here's what happens when cases are discovered. First, the patients are quickly isolated in quarantine centers or hospitals. Depending on the severity of the outbreak, the government responds with localized lockdowns, mass testing, and tracing efforts, while intensifying the vaccine rollout all at the same time. Sample this. The city of Guangzhou, with 18 million people, conducted 28 million tests between May 26th and June 7th.
Testing actually covers all the 7 major districts in Guangzhou city.
China has also maintained tough border restrictions to keep the virus out. And with the emergence of new variants, experts think that is likely to continue, at least for this year. Traveling to China is possible, but the strict testing and quarantine rules make it extremely difficult. Another big takeaway, almost everyone in China wears a mask in public places, even if when they are fully vaccinated. The messaging has been consistent from day one, and it is in line with the latest WHO recommendations. Countries like the US and Israel overturned their mask mandates for vaccinated individuals. They are now witnessing an uptick.
Israelis had stopped wearing masks and abandoned social distancing after one of the world's fastest vaccination drives. Now it has reinstated the mandatory wearing of face masks indoors.
So, no country, including China, is out of the woods yet. The only way out for every nation is achieving herd immunity through mass vaccinations. China is on that path and is moving fast.